But this time, we want to really talk about some of the myths around giving birth, because like we just talked about, there's so much information out there when it comes to giving birth, becoming a mom, that I'm sure there's a lot of myths that are just out there that
Yeah.
people are kind of circling through, families and all that. So let's talk about some of the biggest myths around birth and let's just debunk them.
Sounds good. I have three written down. There's a lot more than three out there, but I have three kind of bigger ones that written down. So the first one is about C-sections. And I get this question a lot in my DMs about, I had a C-section the first time, can I have like a vaginal birth after having a C-section? A lot of people don't even realize that it is possible to have a vaginal birth after you've had a C-section. It's not like once you have a C-section, you only have to have C-sections. It's called a VBAC, vaginal birth after a C-section, or a TOLAC, a trial of labor. In regards to VBAC, I get a lot of questions about this because a lot of the time it's from people who have had C-sections the first time, who they were unplanned C-sections, and they want to know if they can even try and have another vaginal birth. And it's quite possible. There are a few contraindications that you have to watch out for. If you've had your first C-section in a certain way, in a certain like if you've had a vertical incision, a classical incision, that is a contraindication to having a vaginal birth afterwards. You would have to have a C-section. And then there are various other reasons, maybe that medical reasons that come up in a future pregnancy, like your placenta is covering your cervix, or you have twins and one of them, the first one, is presenting not head down. There's a variety of reasons that you wouldn't be able to have a vaginal birth. But just at like face value, 90% of people are typically eligible to at least try for a VBAC after having a C-section. Now, that, like I said, that goes to say, like, there's contraindications that come up. And obviously it's not 90% of people are going to be successful having a VBAC after having a C-section, but there is a very high percentage that a lot of people can at least try. And this is something to talk to your provider about. So I work at a hospital that we call it very VBAC friendly. So we have a lot of VBACs come through, and we love, VBACs. And the good advice that I've gotten in regards to VBACs, if you're looking to VBAC, is start talking to your provider. And if your provider is a VBAC friendly provider, they're going to be pretty open to almost all interventions. Like, they're going to be open to the fact that, if you want to get it, because some people are like, if you want a VBAC, you can't get induced. If you want a VBAC, you have to do it before 39 weeks. If you want a VBAC, you have to do this. And more VBAC friendly provider is going to be a little bit more open to certain circumstances. So that's a good tip I have for people who are looking at VBAC. Another thing in regards to VBAC too is, just kind of interview your provider during your prenatal visit. And if it sounds like that you're not at a very VBAC friendly practice, it's okay to switch providers at any point during your pregnancy. If you have that opportunity and you have a different hospital that you could deliver at, or you have a different provider that you can switch to, if you feel like, oh, actually, I've heard that this provider down the street, like, it seems like I've interviewed them and they seem a lot more open to the fact that, I could VBAC. It's okay to switch. It's totally okay to switch. I don't want you to be ever afraid, to not switch, regardless if it's for a VBAC reason or another reason, just at, plain face value. Like, it's okay to switch care providers if you feel like you're not being well taken care of. So yeah, that is my first myth, that once a C-section, only C-sections. That's definitely a myth. You can definitely have vaginal deliveries after having a C-section, even after having two C-sections. We've had, moms deliver vaginally. I had a guest on my podcast early on, and she talked about her vaginal delivery after having, two C-sections. And it's not just for indications. If your baby got stuck the first time, you can still have a VBAC. You can still have a vaginal delivery. If your baby was too big, you can still try and VBAC afterwards. There are very little like hard contraindications to VBACing, like I said in the beginning. But it's a lot of these myths that are like, people think, oh, my baby didn't like I never got past 6 centimeters, or I never got, I pushed for 2 hours. Does that mean that I'm always like, I'm never going to be able to birth vaginally? No, that's certainly not true.
Mhm. Yeah, we had someone on our podcast too that was kind of talking about her kind of search for a doctor that would do it because she had two
Yeah.
C-sections and then was able to have a vaginal birth. So that's really
Yeah.
cool to hear those
Yeah.
success stories.
Yeah, for sure. So my second one is a myth is your water will break before you go into labor. We hear that too, that people think that
Mhm.
it's like your water has to like your water has to break and then you go into labor. Or people think that your water can't break before you go into labor. Like it always happens, you always have contractions first and then your water breaks at some point. And the fact is that everybody's different, and about a third of people will break their water pre-labor, and then 2/3 of those people will break their water at some point during labor, and contractions will start first, or your provider will break it for you artificially. But yeah, that's a good one, I think, just to talk about, because we get a lot of questions of like, people are just sometimes confused how the whole process works. Like, what am I looking for here? Like, I
Mhm.
think I think like this is the way labor is supposed to start, but I also have to be, worrisome that my water might break. So it's a little bit confusing for
Mhm.
people. So that's just to say, everybody's different, and your water might break before you go into labor, and that will be the start of labor. It might break after you start having contractions, for a few hours at a time. It might break and then you don't go into labor yourself for a really long time, and you come into the hospital and we have to induce your labor because your body just, doesn't want to contract right now. That happens too.
Mhm.
There's so many different scenarios. So I thought that one was a good one. The last one I have is that a myth, labor will take less than 24 hours. So this is a
Mhm.
good one because
Mhm.
that is true for some people, some first time moms, that labor will, be quicker. And I know less than 24 hours, like that doesn't even seem quick, right? Like a whole day, that seems like a really long time. But the fact, what I really teach in my courses is that I want you to prepare for this long labor. Okay. It might not be long. It might be like 6 hours. It might like be really, really short. But if you go into it thinking, okay, this might be a 3-day process. Like, just, I might have to get induced, and then I might have to prep my cervix for a day. And then, we do Pitocin for a day, and then we deliver on the third day. Sometimes some people have labors like that. And so I like to set people up that way, saying it might be this long. And it's very likely, if it's your first baby, that it's going to be more than a day that you're in labor.